It's been longer than 30 seconds. Well, we're going to presume that we're on. So good morning, everybody. Welcome to the special work session, Las Cruces City Council. Today we're going to be basically working out some of the state legislative priorities. And so with that, who's going to start this off is Chief of Staff, excuse me, or Administrative Office, Chief Administrative Officer, Barbara Bencomo. Sorry.
After all this time, we'll get it.
Good morning, Mayor, Councilor, and staff. Yes, thank you very much. Barbara Bencomo, Chief Administrative Officer. And this morning, we would like to start the discussion with respect to our legislative priorities for the upcoming 2024 legislative session. And this morning, we're going to have several people up here to discuss various aspects of the process that we went through to bring you the information that we're going to be presenting to you this morning. Before we start, I wanted to just show you an overall timeline for the session, and of course for the work leading up to the session, to include this work session, a resolution that'll be brought to council, the dates when legislation will be filed, pocket veto dates, and the effective dates of the legislation going out to May 2024. But the session itself will start on January 16th and end on February 15th. And with that, I'm going to turn it over to Larry Horan to talk about an overview of this upcoming session, some of the trends and issues that he's hearing and that he's going to work on for us. So thank you.
Good morning, Mayor, members of the council. Larry Horan, lobbyist for the city of Las Cruces. It's good to be back in front of you as it seems like we just were a year ago going to the 60-day, and here we are back about to go into another 30-day session. It doesn't seem like the breaks get any shorter. It seems like they come quicker and quicker. So as Barbara mentioned, we're going into a 30-day legislative session.
It's the wrong slide. There we go.
Oh, I probably did that. A 30-day legislative session starts on January 16th. As a reminder, 30-day sessions are different. They're short session or budget sessions, and they come every other year. So the legislature is limited into what they can consider. It's revenue matters, appropriations, messages from the governor, meaning the governor can send a message to the legislature saying, I will allow you to consider legislation related to gun violence, to DWI, anything that is not revenue or a budget matter, and then they can consider legislation on that topic, and then also legislation that has been previously vetoed in another session. This year, what are they really focusing on? It's going to be a challenge just to pass the budget in a way, in a responsible way, not because we don't have enough money, but we have almost too much. There's the last forecast of revenue, our budget is just over $9 billion. The last budget forecast came in August, and it was a $3.6 billion in new revenue over and above what's required to pass the budget. And it's still trending up. They should have another revenue estimate in December. The numbers we're hearing it's still even higher than $3.6 billion. And so, although it's a good problem to have, and we don't want to miss the opportunity to do some transformational things in the state. It's also difficult because there's only so many places they can sock away money, and there's only so much they can spend on things like capital and infrastructure, because what we're starting to see is last year we had over $2 billion that went to capital outlay. It's hard to spend that amount of money just because for smaller projects, and when I say smaller, $1 million or less, what communities are seeing is they can't get contractors to bid on their projects because there's so much work available, and so it can create other problems that you wouldn't think wouldn't think of would come with excess budget revenue. The other thing that's happened is, as it relates to capital outlay specifically, which we'll talk about a lot of our projects later, is because prices have increased so significantly for lots of reasons, that there's a list of projects that when you receive funding, you think they're going to be fully funded, but we're seeing, because construction costs are increased, you have a bunch of projects you thought you had full funding for, now there's a shortfall. So one of the things the legislature is going to look at is identifying those type of projects that have already had funding approved. Now, because of increase in cost, they don't have enough funding available, and they'll look to fund some of those with capital outlay dollars. And what we're hearing about capital outlay is about the same as they had available for last year. So House members had just over 2.5 million. Senate members had just over 4 million. It's looking like it's going to be a similar number this year. So the dollar amount that we'll be looking at, similar to what we had last year. That does not include statewide capital outlay projects, and it does not include what the governor will have available for spending. So when it comes to capital outlay and project fundings, it's divided a third to the governor, although the governor's third is usually more than a third. The governors tend to like to take a little bit more money. And then the House gets a third and the Senate gets a third. So we'll have similar spending available as we had last year for capital outlay. So they'll be focused on how to pass a budget, and it's a challenge simply because of timing. So in a 30-day session, the House generates the budget, and it always starts in the House. And by about the midpoint, so January 31st is the midpoint, they want to get that budget over to the Senate so the Senate can start considering it. So that in and of itself, just to pass, because of the size of the budget, eats a lot of the time and eats the time of the Appropriations Committee. So not a lot else probably will get done. They actually start meeting about a week before the session, the Appropriations Committee and the Finance Committee, to start crafting the budget. So it's more like a 35 or 37-day session as it relates to the budget, but that's going to be their primary focus. Probably secondary to that will be crime. And when I say crime, it's a broad topic, a lot of issues and topics to discuss, but because of what happened throughout the interim, the ongoing issues, particularly in the city of Albuquerque, but other cities, we're starting to see an increase in unhoused or crime related to that. It's going to be a significant focus for the legislature, especially coming off the governor's administrative public health order with the gun order about prohibition of carrying guns in public places. There's going to be a lot of legislation introduced related to firearms, and a topic like that literally can kind of suck the life out of the legislature as it relates to everything else. It will just consume an enormous amount of time and energy from legislators. So that will be a significant focus this session. There's talk about potential oil and gas reform or modernization of the Oil and Gas Act. Again, anytime something like that is introduced, it's a very heavy lift, and so that can take a significant amount of legislative time and energy. It's not clear whether that will happen this year or not. And then also, as they've been continue to deal with the Ozzie Martinez lawsuit about the constitutional obligation to provide adequate education, there'll be significant discussion about how we're funding education, the performance of the public education department, particularly K through 12, and then also with CYFD with ongoing issues. There'll be legislation introduced related to CYFD reform. That may or may not get a message just because the governor just appointed a new full-time CYFD secretary. But just those few topics, although it doesn't seem like a lot, since they're such heavy lifts in a 30-day session, that will really consume the legislators' time. And so I don't think we're going to see a whole lot of legislation related to issues that's not on that list, just because they're going to be very focused on that. And the other thing, and it's as we talked about things like oil and gas reform, one thing that can have an impact on that is the governor has a significant cabinet vacancy. Last I heard, there was 9 cabinet secretary positions that were vacant, and we have interim secretaries. So when you talk about something like oil and gas reform, the Secretary for Energy, Minerals, and Natural Resources just retired, left, and so there's a vacancy. If you don't on a big issue or a big topic issue like that, if you don't have a good leadership in a department to really push a big piece of legislation like that, it's difficult for things like that to move. And so it's, as all 30-day sessions are, it will start off with a bang and we'll continue at a frantic pace the entire time. And there's not much buildup in a 30-day. On the first day, you kind of go up to the top of the peak and then you just stay there the whole time. The other thing to consider is all the legislators will be going into an election next November. So the Senate and House are both up. There's been some significant move of senior senators retiring / resigning. And there's also a significant number of House members who are looking to move over to the Senate. So one of those vacancies actually is still, has not been filled. Senator Stuart Engel, who has been the longest serving legislator from Portales, just retired. And so there are House members who want to take that Senate seat. And so there's going to be changes potentially in leadership and committee assignments just going into this session because of some of that movement. But you have a large number of House members that are going to be moving to the Senate. So when we talk next year at this time, the makeup will be different because of two things, because of the election, and also we know that some of those members will be leaving. And so I will pause for an overview on that, but I'm still available for any discussion or questions as we move on, and I think Shrejana's next.
Thanks, Larry. Appreciate that breakdown.
Good morning, Mr. Mayor, City Councilors, Shrejana Vasna for the record. So we went through a slightly different strategy this year, kind of going off of last year, our city manager offering up a more legislator-oriented strategy to asking them what their interests are and what they would like to fund, as in what are their priorities first, and then trying to match up some of our existing needs to then go back to them for capital projects to be funded. So we had quite a few sessions with the state legislators, and here's the rundown of the key points that we heard most often. So affordable housing was definitely a high issue. Active transportation came up several times. This is, of course, bicycle and pedestrian safety and transit as well. Behavioral health was another topic of interest, and public safety, which is no surprise, and also sustainability. So these were kind of the key issues. And then once we heard from them, collected our notes, we went back to the departments and also convened the CIP, or the Capital Improvement Planning core team that we established last year. So I'm gonna, sort of remind City Council that we did a CIP retreat last year where we introduced a new criteria set for our capital projects. These criteria would include things like operational impacts and community benefits, and also do these projects align with our long-range and comprehensive plans. So we try to do a condensed version of that process, and then I will run through a list of projects that are sort of in the order of scoring, if you will. So the first project to request funding for to the state legislation would be mobile integrated healthcare building. This is our fire department's project where they are going to convert Fire Station 3 into this new building, which is going to house their MIH and Project Light programs. The total project cost is $6.2, and the requested amount is going to be $4 million. And of course, I'm going to run through these, but we have our departments and our staff available to answer any particular questions and give you more details on any of these projects. So then we are also going to be creating an active transportation bucket, if you will, in our ICIP database and request funding for kind of the list of improvements that you see here, but really focusing around how to make our roads safer for pedestrians and cyclists, as well as comfortable for transit users. So sidewalk gaps and improvements. ADA, of course, is a given. Once you touch a project, we will always bring it up to code and to ADA standards. Transit shade structures, the bus shelters were mentioned during our meetings, street lighting that can help pedestrians and cyclists, as well as motor vehicle users, of course. But then we can also have intersection improvements where we already have bike lanes or bicycle facilities leading up to an intersection. Usually at the intersection is where the cost gets a little bit high. And so creating a funding opportunity for that is logical. And then, of course, the actual bicycle facilities. And this should be really based on our active transportation plan and the projects listed in it, which have gone through, public and city council vetting. We also have street trees thrown in there just because, to create a pedestrian environment. Street trees do create safer streets as well. The total requested amount here is $6 million. Then in terms of affordable housing, Amador Crossing would be the number one project to go after state funds for. This total project cost is $7.6 million, and the requested amount is going to be $7 million. This is, of course, our Community of Hope permanent supportive housing complex that proposes to build out 40 to 50 units.
Excuse me, Shoshana, what street, where is that going to be located?
West Amador.
And what was the cross street? I can't quite read that. Make sure. Oh, okay, got it. I know where that's at.
So Lift of Las Cruces, this is a standing project going before the legislators. Last year was our first Lift Up project request, and this is the second year. The second area for Lift Up has been identified as kind of central to the city, and Valley View Park falls within the boundaries of that Lift Up area. So the total project cost on that is estimated to be $7 million, with the requested amount being 4.2, and that includes quite a few renovations and also improvement of the trail system. And then there's going to be a breakdown as we propose multiple items that the legislators can sort of go down the list of, and Larry can strategize as to how much and kind of, where that can get us. Of course, we will have other projects in here, but we're still in the process of identifying those projects in the Lift Up area because the public survey results have not been shared yet. So we'll see some more under the Lift Up bucket. Then Fire Station 9, this was a GO bond project twice. The total projected cost of this building is $14.6 million. And the requested amount right now is $2.4 million. The East Mesa Public Recreational Complex, this was also a GO bond item, which the total project cost is identified as $38 million. And so there is still an additional need of $25 million for this project. And we are, for this round, requesting $12.6 million with, again, a menu of items ranging from $800,000 to $5 million each. And we do have our Parks and Rec staff here who can break those down for you all if you are interested. And then we have this last sort of slide for the capital project requests, which we're calling finish line projects. We heard legislators be interested in trying to complete out projects that could have been struggling to get completed because of inflation or during the pandemic, cost and supply issues. We are also putting together some double duty here. So South Main Street is one project that has a total cost of 5.8, and we are requesting $1 million to complete out some active transportation components. So That is one road being requested. Sacramento was another road that actually was in the first lift-up area, and we had received some funding from the state on that. However, the requested amount is $1 million, which should complete out that road project, and which for a total cost of $2.1 million. And then we also have our wastewater septic systems project, which we put on our list every year. This is to I guess put in the main lines for the sewer system where there's septic systems near well areas and potential environmental hazard. So, the amount requested this round is going to be $1.6 million. And with that, I will stop and hand over to Lisa Larocque unless you all had any questions.
Okay, thanks, Shoshana.
Hello, Mayor, Council. My name is Lisa Larocque. I'm the Sustainability Officer. I have one slide to present to you about the sustainability policy. Each year, we have been, as a member of the Coalition for Sustainable Communities of New Mexico, we have all rallied together to try to support sustainable policies. And given the exciting and agenda for this year, that we know that the priorities will be towards funding, but there is one area that overlaps with that, and that's the establishment and funding for the New Mexico Climate Investment Center, which is equivalent to a green bank. And what that does is it offers very low interest loans for special climate-related projects that can be anywhere from green infrastructure to energy conservation and other sustainable measures. And it's most often targeted as an equity-related funding source that helps lower income individuals, families, and pueblos. So this has already been approved by the governor, but it will establish the corpus for the Climate Investment Center. And that's the one policy area that we're advocating for this year, or recommending for advocation. And with that, I'm not sure if it goes back. Thank you. Sorry.
Thank you, Lisa, Shrujana, and Larry. And as Shrujana said, we also have departments here available to answer any questions you may have. Before we get to that, I just wanted to mention again the next steps so that we can continue in this process and submit our capital projects to the state. We'll be bringing forward a resolution on December 18th for your consideration. Then we, once that resolution is passed with your priorities, then we have a deadline that staff will be working towards to submit those projects to the state. That'll be in January 11th. And then just as a reminder, there will be Las Cruces Days in Santa Fe towards the end of January. And I know that Ifo, Sonia, and Akani are all planning on being there along with other staff to help advocate for our priorities as well. So with that, I'll go ahead and pause so that we can answer any questions you may have.
Thanks, Barbara. I just want to say, voice my support for all the projects that were listed. I think they were all good, and looking forward to that coming about. So, Councilor Graham?
Yeah, just one general question before we get into the details. Have we nailed down where the next lift-up area is going to be? Cool.
We do, and I believe we have Isaac Holguin here, yes, and I actually have a map, I believe. But I'll let Isaac speak to that.
Hello, good morning, Mayor, members of City Council. Isaac Holguin with Housing and Neighborhood Services. Currently, we did a scoring matrix to identify which spot would be the location would be the best for the Lift Up Neighborhood 2. And it is located on between Amador and Idaho, and then it also encompasses El Paseo and Campo, I believe, all the way up to Solano. And that's where the next Lift Up Las Cruces will be located.
Great, thank you so much.
No problem.
Thank you, Mayor.
Thank you. Thanks, Isaac. So just a thought for Larry is a couple things. One, obviously there's a fentanyl crisis going on in the state. And have you heard what possibly could be done to help local law enforcement combat that? That's one. And then two, these are unprecedented times to see this type of money that's available. And you would think that this would be the time to possibly look at a mental health facility for southern New Mexico, here in southern New Mexico. I mean, because literally they could do that. And I recognize that all the legislators do get certain type, monies that they put aside. But what are your thoughts on those two things? One, what are you hearing that could help law enforcement help combat the fentanyl crisis? And two, what are your thoughts about possibly another facility similar to what's in Las Vegas, here in the southern New Mexico?
Thank you, Mayor. As far as the first, I have not heard anything specifically dealing with fentanyl and treatment as a topic by itself. But when we're looking at criminal justice, and you're looking at potential programming as it relates to criminal justice, not necessarily just reform, but combating the issue, and behavioral health. Your two questions actually tie in well together. I would not be surprised, and I think that will come up in the discussion of how we're going to deal with and reduction in crime itself. And so treatment would be for both behavioral health funding and also for treatment. I suspect if it's not even a standalone legislation, will be included an increase in the budget. As far as it relates to the mental health, behavioral health facility, I don't know that the concept is ready for actual funding for a hospital in the southern part of the state, but it's something that we had, like when we met with the governor last year, we brought up and had discussion with. I identify on the capital outlay, you have services that it relates to behavioral health. So I think there's a potential for us to try and get funding to help bolster behavioral health services. I just don't know what it's going to look like. And we've had these discussions, and Mayor Pro Tem has been pushing this for a very long time as a priority for the city. So I think it's a good time for us to continue that conversation and identify what's the best way to bring those services, and what does it look like? Is it a hospital? Is it other treatment facilities? Is it inpatient? Is it inpatient, outpatient? What's the mix? And I think that this is a good time because behavioral health is a big topic as it relates to not just standalone, but also to the unhoused and also to crime. It's all tied together.
Okay, thanks, Larry. And I'm going to ask, if I can, to put the chief on the spot a little bit. Chief, if you had your druthers, is there something that you think that would help you and your department help combat the fentanyl crisis? And if so, is there something there that you'd like for us to entertain to possibly ask the legislature to help fund?
Good morning. Jeremy Story, Interim Police Chief. Mayor, members of council. If I had my wish list, there's lots of things. I do agree with Larry. He's hit the nail on the head. These are complex problems, and they're all related to each other. I see in my short time, even as interim chief, I've seen that there's a lot of good people that are very intelligent and motivated to impact substance use issues, homelessness issues, and mental health, doing good work. And I think having one central facility in southern New Mexico would be very beneficial. We don't see a lot of commitments go up to Las Vegas, even on the more severe or extreme cases. I think having a facility here would help us. Having more resources for long-term inpatient treatment, I think, would be beneficial. When it comes to fentanyl, it's such a difficult problem. We have seen in a short period of time, 3 to 4 years, a transformation of the reality for officers and everyone else that works in that field. With heroin, as bad as heroin is, fentanyl is at a whole nother level. And I'm not sure what the answer is, other than it's going to take all of us working together. It's not necessarily a law enforcement problem by itself. It's not even a treatment problem by itself. It's difficult. Trying to beat the addiction in one person is hard enough, and we look at how fast it's spread throughout the community. I think it's going to take a very holistic, multifaceted approach to deal with it here.
Thanks, Chief. Yeah, this morning I was listening to the news, and there was some young kid who, I guess he bought something on social media, Snapchat or something like that, and he was buying Percocet, and it turns out had fentanyl, and he died. So, and then over the weekend, I was listening to NPR, and they were talking about schizophrenia, on how that's on the rise as well. And so it's just, unless the legislature can help fund some of these issues to help our health providers and such, it's just gonna continue to grow. And we need to, I think it's incumbent on, as you mentioned, the community, both city and county elected officials, to work with our lawmakers to help come to some type of solution, or something to at least help keep it from just continue to take off. So Mayor Pro Tem, she had some comments on this.
Thank you, Mayor. Thank you, Larry, for the presentation, Serjana and Lisa. Appreciate it. Yeah, I agree. I don't see this as part of, and almost every year that we've come in front of the legislature, we offer at least our feedback related to a mental health facility. I think it's something you need to continue to put on your list, and it's just going to get worse. So what I'll say is there's a local behavioral health collaborative that's having their meeting, their end of the year meeting next week, I believe. Lieutenant Howie Morales will be here along with other specialists, and Chief is right. There's a number of people working collaboratively. Barbara, you're a part of that through the opioid settlement funding. All I would say is that you need to coordinate those efforts. There is a large group of people that are working on this, and more specifically, identifying a mental health specialist, EFO, something I've been talking a lot about, someone around that has that kind of expertise, because we don't have it within the city, and it just falls off. It's not even a part of the priorities as staff comes in front of us, and I'm not criticizing. I'm just saying it's typically not a municipality function, and it's just going to get worse. So wherever it lands, if it's in fire, police department, it needs to be, I think, on the forefront of everything that you do, because all the things that you're doing, lift up, a number of these programs, light, it's just going to keep affecting it and getting worse. So if anything, you need to identify that person and Mayor and I had worked on a behavioral health district that didn't really come to fruition, but it's something that you'll need to have, and someone that's sort of advocating for that at every single turn. So I would just say resilience leaders we spoke of last Friday, more specifically, which is, if people aren't familiar, it's a collective impact group that has 10 sector leaders working on the survival and thriving services. One of those is behavioral health. We're talking a lot about legislative priorities. More specifically, the local behavioral health collaborative is looking at the Amigos Project, the Soteria House. To your point, Mayor, about schizophrenia, much of that is drug-induced, and fentanyl, that's what you're seeing. And so I'm asking this be a part of the priority. It's a must. A mental health facility, and Chief, you hit the nail on the head. Being able to have those kinds of conversations with chief and police officers in terms of, and your judges, right, that are making those kinds of determinations to send folks. They're not even sending folks to Vegas anymore, really. I'm not sure what that problem is, the barrier, but if we had something like that here, that would be more helpful to our area. And Larry, we've talked about having other counties be a part of that conversation. So with that, I'll turn it back over to you, Mayor. Thank you.
Mayor and Mayor Pro Tem, if I made a couple comments in it from both Mayor, what you indicated, and Mayor Pro Tem, there are not necessarily directly related to a behavioral health hospital. There are some other things going on that we will see this session. So the governor and the legislature last year created a healthcare authority, and part of that is to break down the silos between, you have Human Services Department, you have Department of Health, you have other departments at the state that are dealing with healthcare-related issues, even as the IBAC, the State Employee Health Plan, they're all housed in different places. And the report is supposed to come, it was supposed to have been out, I think, already, but the plan for the creation of the Behavioral Health Authority and whether or not they need implementing legislation is scheduled to come during this 30-day session. So as we're dealing with things like behavioral health, that and a lot of the healthcare is provided through Medicaid, which is run by Human Services Department. So in addition to the creation of the Healthcare Authority, you also have the new Medicaid contracts that they're negotiating and are going to effect on July 1. So you have different things happening related to behavioral health there. And the other thing, in a place we normally wouldn't necessarily think about it, especially as a municipal government, a lot of what we're talking about, not just behavioral health, but also healthcare in general, is how can we grow the healthcare workforce and keep that workforce in the state. And so there are things being discussed like loan forgiveness, higher ed programs to increase the amount of social workers, nurses, healthcare-related fields, and then also even things such as discussions on paid internships for college students to try and make the connection between them and their community to keep them here in New Mexico. So although it's not specifically related to a hospital itself, if we're supportive of behavioral health initiatives, there's lots of places we're going to see suggested changes and improvements in the system in this session.
Councilor Flores.
Thank you, Mr. Mayor, and thank you, Larry, Mr. Haran, and Barbara, and Srijana, and Lisa. Thank you all very much for all your work. I appreciate it. So, Larry, I believe you stated that there are coordinated efforts throughout the state to address the behavioral health, mental health issue. Is that, did I?
Mayor and Councilor, there's discussion. I'm not sure how coordinated it is. I know there are different efforts that we're hearing, and different legislative committees have had discussions on it. So we will see behavioral health related issues.
So there should be a coordinated effort. So what does it take? You say the governor has a lot of money. There's also the general fund that is just billions of dollars, and if we plucked out $1 billion, it would still feel like taking a hair off of a cat's back. There's so much money there, and I know Senator Souls, there was a great feature article, or piece, excuse me, by Mike Cook, where he quoted Senator Souls, and then I asked Senator Souls if that was all true. Not that I don't trust Mike, he's a wonderful, wonderful journalist, but he said, yeah, it's all there. Yeah, we've got lots of money. New Mexico isn't poor. I said, well, you could have fooled me. How do we get that money? I mean, it's not going to take, for those of us, I mean, I'm not a professional lobbyist, you are, and when I've been to Santa Fe, I haven't been up for a couple of years because the legislators are just running around like chickens without heads, and it's chaotic, and it's crazy making. And but I am going up this coming session in January, and I want to make sure that the things that we have laid out and aligned are addressed. So, Larry, you as a lobbyist probably have access, and you probably represent other municipalities. Does this issue come up with other members of your clients, for lack of a better word? And is there any effort to bring us together and get, the mayor, the governor to be responsive? With all due respect to the governor, there's been very little empathy in terms of her actions. And I look forward to her no longer being the governor. It's a very, because it seems like, well, I'm not going to tell you what it seems like, but the net effect is that we're not getting the money we need. And then there's also this windfall from gas and oil. And then they say, oh, there's all this money. And for those of us who feel like, well, we believe, not feel, but believe that we have to be careful in terms of the environmental impact all of that has, Yeah, there's a lot of money. Where's it going? Look at all the issues we have, and I'll bet my bottom dollar that we haven't brought up anything you don't already know and know a lot better in terms of other municipalities and jurisdictions throughout the state. So how can we as individual counselors going to Santa Fe be effective? And that's why it's like, why waste the city's money on going to an expensive hotel, and then my time and boarding my dog and making sure my plants get watered, et cetera. What would be the most effective way for us to conduct business when we're there? Except, looking for you.
Mayor and Councilor Flores, I'll take your last question first and then back in
Sure.
to your initial, if that's okay. Just the fact that you are willing to travel to Santa Fe and meet with our legislators has a significant impact. It may not seem to you, at least initially, but there's a dynamic that when other elected officials are talking to our elected officials, it's very different than if it's staff or if it's a professional lobbyist. So when you go up and advocate as a counselor for the city of Las Cruces, and you take the time to make the 4-hour drive to stay in Santa Fe, to board your dog, and to go have a discussion on these issues, it has an impact. It doesn't just have an impact on our legislators, it has an impact on all of them. I'll give you an example. Because of timing, good planning, and luck, because it is chaotic, but there is some planning that can go into things. When the tax reform bill was scheduled in the House Tax Committee last year, and it included an elimination of pyramiding of gross receipts tax, which had a significant impact on cities in particular, it just happened to be Municipal Day. And so you had a whole bunch of not just city managers, but elected officials who were in Santa Fe and were able to talk to the legislators and testify to the committee about the damage that pyramiding could have on local governments and the services we provide. And that provision did not remain in the bill because those voices were heard and they were there. So just by being there and having a discussion on these issues and asking those hard questions of legislators has a significant impact. It's always worth a trip to Santa Fe. Something good always comes of it. As far as coordinated efforts, there's discussion going on across the board as it relates to behavioral health, fentanyl, and crime. DAs are having it, the AG is leading efforts. You have discussions in the healthcare field. The Municipal League talks about a package as it relates to crime. Every year we've been working on law enforcement legislation every year. Yes, there's lots of money, but the part of the problem comes in how are we going to spend it to help solve the problem. And one of the biggest issues we have as it relates to this is availability of workforce. I talked a little bit about it like when we're talking about capital outlay. If you have $5 billion that can go to capital projects, but we only have the capacity to spend $1 billion because we don't have enough contractors, it's the same thing as we're seeing in healthcare. Part of the governor's public health order has requirements for managed care organizations to provide behavioral health services within a certain period of time. But if you don't have the counselors, if you don't have the doctors, if you don't have the social workers in the workforce, even though you may have the money to spend, how do we provide the services to those who are in need? So that's a big part of what the legislature and also local governments, we're all struggling with is, where do we put the funding and how do we increase that access? So that's part of the challenge that they have. If there's a good plan put in place to deal with an issue like fentanyl or addiction or crime or homelessness, the legislature is able and willing to spend the funding. And a second thing is starting to happen, and I know we talked about it as a priority last year. I didn't mention it, I should have, because there's a discussion about modernization. That's the word that legislators use, modernization of the legislature. So they did put out an RFP to look at what does that look like? What does staff look like? How do we bolster the resources of the legislature so it's easier for them to deal with these complex issues? That hasn't happened yet, but what what we're seeing, and I can point to some concrete examples, for the first time, the Senate Finance Committee has a full-time, year-round chief of staff. For the first time, the House Appropriations Committee hired a full-time, year-round chief of staff. That gives a different perspective to the legislators because they're not just relying on Legislative Finance Committee. They now have someone else who's also looking at the issues. And even in the short time that that's been in place, the Finance hired theirs right before the session last year. The Appropriations Committee hired theirs in, I want to say July or August. They've only been in place a few months. There's a significant, you can feel a significant difference as you're talking about these complex issues. So part of what's going to happen, we don't know what the modernization will look like, but it will transform how the legislators engage. Because when you're dealing, the fentanyl issue, and the chief talked about it, fentanyl, it's a behavioral health issue, it's a healthcare issue, it's a public safety issue, it's a mental health issue, it's a housing issue. It's so complex, and that's just one thing. In Medicaid, the Medicaid budget takes up billions of revenue in the state. Half of our population is on Medicaid. The Medicaid contract is complicated. What the legislature has to deal with is becoming more and more complex as our society is more and more complex. So they need to put things in place to help them address these issues rather than just coming in every 30 or 60 days.
Thank you, Mr. Hand. The one point that you brought up is, well, even if we did this, we don't have the personnel, we don't have the bodies, the people to fulfill all those positions. I'm a firm believer that if the word gets out that New Mexico, right now a lot of our doctors have left to El Paso because of this, that, and the other. But unfortunately, some of us are able to still, to commute to, a 2-hour, 1-hour drive, 2-hour round trip. But it seems to me that if you build it, they will come. And I think that if there's a strong voice, if there's a strong, I really can't believe, I don't want to believe that legislators, whatever level, whether it's municipalities or counties or the state representatives, wouldn't want those programs and advocate and make it a top priority, because as you very well stated, and we all know very well, is that it's definitely, it's really the poverty, it's really a fundamental basic thing, and then of course the racism. And even though the state of New Mexico is primarily, quote, Spanish, unquote, we're still treated like second-class citizens. And I think that, and then also our Native American communities have been ignored, and of course we all know through the centuries have been horribly abused and slaughtered. But I think that it's very important for the state of New Mexico to say, we have all this money, we're going to invest it in our people, and we have to start getting whatever and start, and I don't know, you would probably be more savvy about this, but it seems to me that the build it and they will come mentality it's more difficult than just build it, because of course it's very complex, but I think that if the state was to show that it really cares about people, its people, I think there's going to be a turnaround in terms of how people live their lives. Think about it. Most children who are abandoned or abused or not fed correctly, not educated correctly, are the ones who are not going to have a good outcome in their adulthood. And if we take care of our children now, and then we take care of those that, just weren't as fortunate, I think we'll be a better state to live in. So, Larry, do you see how all this money is going to make a big difference? Are we going to still be hearing straggling a year from now, 10 years from now, 50 years from now, the same old, same old? What do you think?
Mayor and Councilor Flores, although it may surprise you a little bit considering the profession that I'm in and maybe the profession that I came from, I still am a little bit idealistic. So I do think that the state will improve and will take those necessary steps. And part of that is I see the makeup of the legislator and particularly legislative leadership and how they're looking at issues now versus maybe they have in the past. And specifically, I'll point to the House with Javier Martinez as Speaker of the House, Ryan Lane as Minority Leader from Aztec. It's a different generation. They're younger. They view things differently. The Speaker was an advocate, and you bring up the challenges with education and feeding of our children, and that he was an advocate for the Early Childhood Trust Fund and creating the Early Childhood Department and pre-K and those type of programs. So I think we're seeing a shift. And in fact, I think generally it feels like, and this is just a feeling, so I can't point to a piece of paper or anything that's happening, there's a significant, like a generational shift happening in the legislature. It's not only with membership, but it's how they view things, how they address and how they tackle issues. And so I think that this new group of legislators, as we're starting to see this change, I think we will see significant changes that'll help improve, and they'll take advantage of this opportunity of increased funding, because although it's a finite increased funding because it's dependent on oil primarily, there's a disagreement of how long that's going to be. The short end is probably 5 to 7 years. Industry thinks that this is more of like a 30-year trend. And so somewhere in there, we have that opportunity to change the state. And part of what we have to do, because I've been here before you talking about the fact that we're trying to avoid cuts, and we didn't get any capital outlay because they didn't have a capital outlay bill because the budget was down so far. Those big significant swings we see because of an oil-dependent economy. We have to diversify our economy. We have to figure out what do we bring in, how do we keep the next generation of educated New Mexicans to stay in the state, because once you have a connection here, you have a vested interest in helping improve the state. So all of these things we're talking about, I think as they're successful, as we make those connections with the community, it will help make those improvements. So that I'm not back here in 10 years or 15 years still talking about septics, which we probably will because that's a huge problem, but that we've made steps to improve these other areas that you're talking about.
Yes, and then Yazzie Martinez, some money is being allocated for that, and Yazzie Martinez was decided quite a long time ago, several years ago, and there's been very little movement. There was all that fiasco over Native Americans during COVID, not getting computers, the children. So what money is being allocated to Yazzie Martinez, and why is it PED? Yeah, PED. Why is it dragging its feet, and what kind of money do they need to make sure that Yazzie Martinez gets the holding and that decision gets implemented?
Mayor and Councilor Flores, it's actually a good example of to what your original question was, which is we have all of this money, how do we fix the problem? So Yazzie Martinez, they've increased teacher salary, they've significantly increased funding for education, and they've poured money into trying to solve the problem. And depending who you ask, it hasn't moved the needle at all. And so it's exactly what we're talking about, is having the funding in and of itself may not be enough to solve the problem, because the legislature says, look, we poured a lot more money in education, and the plaintiffs in that case say it has not been enough. Now, where it goes, and especially, I will, for a disclaimer, do not have any K through 12, nor do I lobby for any K through 12 education. That's a whole different area. Mm-hmm. But and it depends who you ask. If you ask Representative Derek Lente from San Diego Pueblo, also a member of Isleta, they haven't done nearly enough, because he introduces legislation every year to increase funding specifically related to Native American education, and some of it gets implemented, some of it doesn't, but there's also struggles at the local school board district level, there's PED, so it's a good example of we have the resources, but where do you put them to make it effectively change the system?
Well, thank you very much, Mr. Horan. I look forward to seeing you and calling you between now and then. Thank you.
Thank you.
Thank you, Mr. Mayor.
Thank you, Councilor. Any other comments? So I got one question.
Okay.
I don't get, I have to remember that it's probably the last time I get to ask you some direct questions without having to pay for, services. The state, every so often, the city will do a strategic plan. So we can kind of get input from council and to see how we want to move the city forward and listen to what they're hearing from their constituents, what they need, and we all come together to try to pin it out, point it out, and figure out how we're going to pay for it. Does the state do that? They don't, do they? Everyone just comes together at the legislature, they do what they want to do, and they're just doing little parts here and there. There's no big plan for the state. I don't believe. Like a strategic plan. I mean, I know that's silly, but we don't do that, correct?
Mayor, there's not one that I'm aware of.
Yeah.
What I would point
I
out
Googled
is
it before I asked you this, so I didn't want to have egg on
they
my
talked
face.
about doing a 50-year water plan for the state of New Mexico. Water, as you know, has been an issue we've been dealing with since inception, and that was something that they've taught. I'm not even sure that that's been adopted yet. So no, there's not a comprehensive plan for the state.
Basically getting the legislators together, kind of talking about what's going on in their various cities and seeing exactly how can we combat the things that they're seeing. But, okay, I just wanted to clarify that. That's all. Thanks for that.
Thank you.
Thank you, Mayor and Councilor. So just wanted to make sure that I understood your guidance and input for the resolution that'll be coming forward on the 18th. I heard the support for the capital projects. Just wanted to find out if you would like to add support for a regional behavioral health facility in southern New Mexico to the list of items that we would adopt by resolution.
If you're asking a question and you want an answer, I think I can say yes.
Yeah, I think that would be the goal. I know, I'm supportive of it. But when Mayor Pro Tem said something, a light bulb just went off. I was thinking about workforce solutions, right? How the state is broken into four parts, and how there's 6 counties, and how we used to, the governor removed me, but how we used to have meetings every so often, and we would reach out to various businesses, and they would help, with unemployment. I don't think they have one in the Department of Health. How they have a special board to combat, whether it's fentanyl, whether it's behavioral health, and how they could reach out to various mental health facilities and help fund them so that they can get. We're talking now, it's a lot quicker, because, it's going to take forever to build. Don't get me wrong, I'm supportive of building a facility. I think it's going to be a long-term issue. But you care to answer that? I don't think there is a board. Ideas are just flowing right now after listening here, but there is not a board, to my knowledge, much like a Workforce Solutions Board, there is one for the state under either Department of Health or Health and Human Services.
Mayor, no, currently there's no such structure in place. I think the collaboratives might be the closest that you have to that. But I think what you're talking about is something a step beyond the collaborative. Right. More of an appointed board with a mix of folks like they're dealing with, the workforce.
Exactly.
With that model. I think if that were to come, that would be something that would now come through that new healthcare authority that they're forming. And so
I looked that up, and it didn't quite jive with what, it's supposed to start July 1st, 2024, but it seemed like it was, it's just another state agency. And I'm
kind of a mega state agency with the idea that they're going to deal with all things healthcare related, including employee benefits, Medicaid, et cetera. But don't know who the secretary is going to be. The plan really hasn't even been vetted yet.
And that's fine. I'm just my own personal checklist here. That's all. All right. Thank you.
Very good. So we will add some language then. Oh, I apologize.
Councilor.
No, I I was just going to ask sort of more to the nuance of what you are proposing. I feel like in the priorities that exist, there is a highlighting of permanent supportive housing as well as Project Light, which are two sort of things that we are investments in community organizations that already exist that I feel like we need to add up our investment in, and folks that we have efforts that we've already invested in. So I wouldn't want to displace those efforts, which are addressing a lot of the issues that were alluded to. I want to make sure that those don't fall in their prioritization, because I think they're concrete and they're folks that we know are already working on this and doing things that are working. So I know how that all goes, or sort of. But in terms of priorities of things that are very close to the top of our list, I would ask that those stay there.
So thank you. I'll just address that briefly, and Larry, you can feel free to correct me if I misspeak. But this list of capital projects, things that the city would undertake to construct, with respect to the regional behavioral health facility, it would be support for that initiative. That would not necessarily be our capital project, might be from the state as well. Larry?
Mayor and Councilor, I don't think I'd ever correct Barbara. But I think what she said is, it actually is kind of the way I'm thinking, and I would just maybe take it a step further. Because we've had this discussion, and Mayor Pro Tem and I have had this discussion. I think if you make a statement of policy of support for increased behavioral health services to include a potential behavioral health hospital or something like that, because I think what I hear when I'm in front of you and I hear you talk about it is, we have a void of services in this part of the state that we need to fill. A hospital may be a piece of it, but it's probably broader than that. So maybe more of a broad policy statement of support for an increased behavioral health services in Doña Ana County or in the southern part of the state, and maybe even including a statement as it relates to workforce and behavioral health workforce. And because it's a much broader issue, so if that's your idea of let's support it, that's a piece of it, but I think there's a lot more there, because when we're talking about behavioral health and what the fire department has been doing with Project Light, that is all helping towards the solution as well. So for me, to understanding direction from the council, that broader statement is beneficial, if that makes sense.
No, I'm definitely here for it. That's sort of what I was hoping was the nuance. So thank you. I appreciate that clarity.
Okay, anybody else? Okay, so is that all the presentation?
It is. Thank you very much. So we'll be coming back with that resolution on the 18th so we can proceed with the capital outlay process. Very much appreciate the guidance and input.
Excuse me, Mr. Mayor.
Yes, Councilor.
Ms. Bencomo, Mrs. Bencomo, to distinguish you. So you will be adding the mental health that you brought up, the
Mayor,
guidelines that
that's right.
Larry pointed out.
Mayor and Councilor Flores, yes, we will add a policy statement for support of additional behavioral health services for our region that may include language regarding the workforce development as well.
Great. Thank you very much. Thank you. And thank you, Mr. Haran. Thank you, Mr. Mayor.
Sure. Okay, well, if there's nothing further, entertain a motion to adjourn.
So moved by Flores.
Second, Abeta.
Motion made by Councilor Flores, second by Councilor Beta, that we adjourn. Christine?
This is on the motion to adjourn the special work session. Councilor Abeta?
Yes.
Councilor Graham?
Yes.
Councilor Bencomo is absent. Councilor Coran?
Yes.
Councilor Flores?
Yes.
Councilor Gondeta?
Yes.
Mayor?
Yes. Okay, we're adjourned. It's 11:07 a.m., and we'll see you all at 1 o'clock.